I am Dr. Prasenjit Dekar, Neurology consultant. I work on epilepsy, headache, sleep and spine disorders. What is epilepsy? In the brain itself, we have got millions of neurons and they fire amongst themselves. If such situation occurs that there is excessive firing of the neurons, then the patient can develop lot of symptoms. As for example, he may become unconscious, he can have a reeling sensation, he can have a sudden blinking of the eyes, or he can fall to the ground. These are happening because the millions of neurons they are firing excessively, not normally, and the patient is showing some seizure, some symptoms, and these are called epilepsy. Epilepsy worldwide is very common. In India, being a developing country, it is still very common, more common than the Western world. Why? Principally because of lack of awareness amongst the society. Most of us don't know what is epilepsy. We think that it's an anxiety, we think it's a kind of a psychiatric illness. We don't approach the doctors. So as a result of that, the patients, they become drug resistant and they reach the doctor very late, where we start treatment, but the medicines seldom work. It works, but it works very seldomly. Now there are various causes for epilepsy. It can happen in a newborn baby, infant, and it can have a 90-plus-year-old geriatric person. There are various causes. One, in the children, most of the causes in India, being a developing India, we still have a poor or unhealthy delivery systems, which cause a lot of problems inside the brain. Common use of forceps, neonatal meningitis, neonatal sepsis, it can cause epilepsy. Coming to the management of epilepsy, in management, I would like to say, in case of what are the investigations? In emergent situation, an CT scan is sufficient enough. Whereas in a routine checkup, we should always go for an MRI because it will give a three-dimensional picture of the brain. Next, we should do the blood investigation, including the electrolytes. Third, we should go for an EEG. An EEG is called electroencephalogram. It picks up the abnormal epileptic signals inside the brain. There are various forms of epilepsy, of EEG. One is routine, which we commonly do, and one is a long-term EEG, which we do for those persons who have a doubtful of history of epilepsy and whose seizures are mostly nocturnal. Third or last, we should do neuropsychology. Neuropsychology also helps us assess to find out where from the epilepsy is arising. Now coming to the treatment. Treatment is mainly three types. One is diet, second the pharmacology or medications, and third is surgery. In diet, we should have a balanced diet. We should try to avoid all those substances which causes epilepsy, as for example tapeworms, less amount of alcohol. Then next, coming to the medicines. Medicines, there are various forms of medicines, and these medicines are suitable, are given to according to the seizure types or epileptic types. Now 75% of the epileptic, they become seizure free once they take the medicines regularly for a period of 2 years. Now in 20% of those cases, their medicines doesn't work. Then we used to add one more drugs as an add-on, and these people, they become epileptic free. Third, if the patient is not resistant, is not responding to the medical treatment, then we have other forms of treatment such as vagal nerve stimulation. Then nowadays, epileptic surgery. In GNRC, we are successful in conducting epileptic surgeries, and this patient, they become epileptic free. So today, being the National Epilepsy Awareness Month, I appeal to every one of us, every one common people, rise and fight for epilepsy, because you can have a normal, healthy life. Thank you.